The following programme, produced and funded by MyFaceMyBody, is also partly funded by Cellulase, iGuide, Zoom and Resell.
Welcome to My Face, My Body, the show that aims to answer all your health and beauty questions. In this series, we'll be travelling the length and breadth of the UK to bring you the very latest cosmetic and beauty treatments on offer, answering all the questions your body needs to hear. So, what does wooden barrels like these have in common with the oldest woman in Scotland? All will be revealed later on in the show. Coming up on this show, we look at the worst bits of our body and popular cosmetic surgery and non-surgical treatment options. We look into lasers, no, not the ones you see on the James Bond movies, but lasers that can do some pretty amazing things to our body. And we go to Newcastle to find out what people's tastes are for beauty treatments. Welcome to the My Face, My Body news this month. A great-grandmother boosted by a boob job is now dating men as young as 24. 65-year-old Joan Lloyd has been unhappy with her breasts her entire life and finally got the op of her dreams this month. She enhanced her assets from a size A all the way to a size F and says the op has given her a whole new lease of life. She has now had dates with men aged from 24 to 50, and the pensioner from North Wales says she's never been happier. Celebrity Big Brother contestant Darren Lyons' fake six-pack has created a storm of attention in the media. The controversy centres around the fact that to achieve his six-pack, Lyons didn't shed one bit of sweat in the gym. He didn't perform one single sit-up or attempt a crunch. No, instead he paid £6,000 for an operation which he's called the male version of a boob job and what surgeons call Vaser high def. The operation itself removes strips of belly fat by liposuction in an attempt to create the illusion of a washboard stomach. And while fellow contestant Paddy Doherty called it the bee's knees, Twitter was less complimentary and compared him to a teenage mutant ninja turtle. Well, that's all your news this month. Most of us are worried about going to the dentist, and yes, the drill. I'm here with Barry Alton at Hazelmere Dental Centre. He's going to tell me about this thing called no drilling, no filling.
Okay. My turn to talk, you be quiet now.
All right.
You're absolutely right. Lots of people have been scared of going to the dentist for years, but it is changing. I've had a look at your teeth. You've got a few areas of early decay, and historically we would either leave them and probably they'd get worse, or we'd have to get the drill out. But there is a new treatment that's come from Germany that means we can treat these with no drilling and no filling.
Wow, okay.
It's called ICOM.
Yep.
Okay. This is one of the delivery units. It treats two main things. It'll treat early decay between your teeth, and it'll treat white spot lesions on the front surface of your teeth. There's no anaesthetic, there's no drill, and it treats it by preserving the tooth that's there.
So what are the typical patients you see coming to your clinic in Surrey?
We have a whole range at our practice in Hazelmere. So we're predominantly a family-based practice, so we look after all age ranges, preschool, children at school, university, up to the elderly. We are a cosmetics-based practice as well. We like to help people make their teeth look better if they wish them to. But predominantly we do functional things, making sure that people's teeth will last a long time. We happen to make them look nice as well as that. And we get referrals from other practices. We deal a lot with headaches and migraines, neck aches, symptoms that many people have never associated to tooth problems. I've been practicing for 15 years and we've seen a decrease in decay But lately I'm seeing an increase in decay in kind of mid to late teens. And we think that is because the teeth are fluoridated. There's a lot of fluoride within the tooth making it stronger. But then there's little tiny breaches, and the decay we're finding is in the dentine. So routinely here at Hazelmere, we x-ray children to ensure that there's no decay there. And we use digital x-rays, which are very low dose.
My smile wasn't pleasant. I was embarrassed on smiling in front of people. I would look at other people and see beautiful teeth and thinking I want them as well. I had all the top teeth veneered. I think in total there are about 8. Treatment took a couple of days, and at the end of the day they just look beautiful. It changes you totally. Now I know I can just smile and people smile with you looking at your teeth. When friends and family saw me for the very first time with my new teeth, they were absolutely amazed. They were looking at them and they were thinking they look so natural, they look so white.
I was speaking to one of your patients earlier on that had an amazing result. I think it was a smile lift. Is this a common treatment that you do in Surrey?
Yeah, it's a popular thing that lots of people would like to have. And we do it to improve the overall look of people's teeth. I mean, you saw Ral's teeth and...
Amazing.
Yeah, and she'd been seeing a dentist regularly for the last 27 years. And unfortunately, maybe not been given the opportunity to do something about it. So we were able to do that. We made sure, first of all, that everything functioned correctly. And then we were able to convert those teeth into something that she was very proud of and looked better. But we do it in several stages. So we don't do it on her straight away. We map it out on models. We create it in wax, first of all. And then we create it in her mouth with temporaries made of plastic, so that she gets to choose how they're shaped and how they look and the colour. So we have a lot of input from the patients so that they get to choose and get the result that they want, really.
Well, from the results that I've seen at your clinic, I mean, for a smile lift, I mean, you can get such amazing results. But what's really exciting is this no drill, no fill. So I'm sure everyone will be lining up out the door.
So the guy behind me, William Shakespeare, gives you a kind of clue where we are today. My name is Dr. Hugo Kitchen. I am the clinical director of the Stratford Dermatherapy Clinic, and I'm going to show you today about 1 or 2 of the procedures that we can perform to treat some of the most hideous parts of your body. Bits that really upset you and worry you. So if you want to follow me, we'll go and have a look. I'm going to talk to you briefly about one of the most popular treatments that we do at the Stratford Dermatherapy Clinic, and people are very keen on body image and how they look, and one of the features that we've noticed in recent years is the obesity epidemic. Now, Falstaff, one of our favourite sons, used to love his chicken and his beef and his bread and everything and loads of wine. This is kind of one of the typical tummies that we might get in, and people aren't sure what they can do about it. Now, we have a treatment called Vaser liposelection and another one called Body Jet. They remove the fat. We would like to be able to trim him down by 2 or 3 inches around the waist. So traditionally, what we take out has normally gone in the dustbin, but now we are going to use that fat that we've taken out for an even better treatment. Fat is going to become the new filler. Now here we have one of our Stratford's most hideous daughters, Lady Macbeth. She was a mean woman and she was rather wizened and frightening. Now, if we just go up to her face here, you'll notice that while she has high cheekbones, she has lost some volume in the mid-face here. So when I was talking to you about Falstaff earlier, one of the things that we can do now is fat transfer. We take fat out of your tummy or your hips or your thighs. We can put it in a syringe and we can inject it back to recreate those lovely rosy apples that Renaissance artists love to paint. Another area. We do a lot of aesthetic work on people's faces. We try to make them look younger and more beautiful. And then suddenly they put the aging hand up to their face and people say, ah, now I really know how old you are. So what you see in the aging hand is the web spaces between the fingers showing the tendons and the blood vessels coming through. So, as you can see, Lady Macbeth, not a young girl, she's got these deep web spaces. We could take some fat out of her tummy, her own fat, she can't reject it, and we could inject it down the back of the hand to plump the back of the hand up. This would make it look 10, 20 years younger.
I've had a few patients, very specialised needs, and have wanted penile enlargements, and it really does affect their lives at the end of the day. And there are certainly a couple of procedures that can be done, one of which is less invasive, which is fat transfer, actually. And you know, it can involve several treatments, but certainly can get the results that they're after. But of course we have a specialist surgeon that actually comes over from Italy to do that, and actually then, you know, they can actually resolve their problems and issues, and dramatically psychologically also change them as well, actually.
The inner arm and above the knee, which I know seems a strange area, but it's a really common problem for ladies because they're keeping themselves in shape now, and what's happening in the skin on the upper knee is starting to get loose, it's starting to drop. So what we've got is a great new treatment called Cellulase, which is over from the States. It's FDA approved, it works on radio frequency, and it helps to tighten the skin. So you'll get that firming effect around the knee area. But then I combine that as well with Restylane Vital, which is pure hyaluronic acid, which then adds volume to the area. And the two together, you know, get a great result. They've now got the firming from the radio frequency, and they got the plumping from the hyaluronic acid from the Restylane.
When you have a smile designed for you, often when the new smile is fitted, patients are apprehensive of how it will look. And that smile is going to be with them for many years of their life. So it needs to be perfect for them. So we provide them what we call a trial smile. So the trial smile is what we create artistically within our practice. We spend a lot of time, a lot of passion, a lot of energy in making it look superb. So that they can try it out for about a week, and they come back and give us feedback on how it looks. And they comment on the size, the shape, the texture, the color, the luster. And we may modify this, and we use this almost as a template prior to the final smile being delivered.
Is it a mould that you make, or you actually put on veneers, and they can obviously be taken out quite easily?
Absolutely. It's something that we custom make, not via a mold, but I actually hand make each tooth for each patient and their smile, depending on their characteristic, their charisma, the face, exactly what they want.
This programme, produced and funded by MyFaceMyBody, is also partly funded by Cellulase, iGuide, Zoom and Resell. Cellulite is treatable at last with Cellulase. Now there is a procedure that gently but effectively modifies the very structure of cellulite with a single treatment. Cellulase is a minimally invasive surgical procedure with long-lasting and clinically significant improvements.
We managed to start treating cellulite in a very more advanced way, and we are targeting the cellulite tissue itself. We make small incisions under the skin, and we introduce a small cannula into the fat tissue and into the cellulase tissue under the skin, and we fracture using the light energy and the heat of the energy, so we fracture the cellulite tissue. Patient will have no scar, patient can function absolutely normal after the procedure.
If you have cellulite, then this is the solution for you. It's time to have your say. MyFaceMyBody has teamed up with the only UK Aesthetic Awards in association with Cosmetic News magazine. Vote for your best aesthetic product and treatment and get your voice heard. Go to MyFaceMyBody and make your vote by the 21st of October 2011. All voters will be entered into a free prize draw to win a fabulous spa day.
My name's Jeremy Rawlins. I'm a consultant plastic surgeon here at Spire Methley Park Hospital, and in recent months we've started doing RECELL resurfacing for facial rejuvenation and also managing patients with problem scars. RECELL is a technique where we're able to take a small specimen of that patient's skin and turn that into a spray of the patient's skin in about 20 minutes, and then use that spray on skin to improve facial aesthetics, facial rejuvenation, scar revision and pigmentation disorders. So it's a fantastic, really new technique, that is allowing us to really improve patients' appearance.
Now, I'm used to seeing lasers on my favourite movies like Star Wars and James Bond, but I found a new laser. Now, I'm with Joe from Mapley Park, who's going to show me how powerful your laser really is.
That's right. Here we have a carbon dioxide laser, and you can hear it humming quietly in the background here. And we're going to show you first of all just how powerful this laser can be. Okay, so we're going to treat Mr. Aubergine here first. Now,
Wow.
basically what this is doing is just cutting a nice neat hole into the aubergine.
Wow.
It's quite deep.
It is deep.
But we don't always use these lasers like this. And in fact they are designed to be used to hit the skin very superficially and more like a pepper pot. So that you can do resurfacing at a much more superficial level without having to go as deep as that. So that reduces the healing time by about 75%.
Oh, okay.
And then it looks very, very different.
Because I'd be a bit worried if it made a damage like that on my skin.
Yeah, that's right. If we actually go to just a light cover, so here we go. Now here, we've got hardly any depth of penetration at all. We've got lots and lots and lots of little tiny shots.
Can we have a go on Mr. Pepper as well?
Oh yes, you actually hit the skin like a pepper pot. So each tiny individual hole is surrounded by a bridge of normal skin, so the healing is much faster.
So what are some of the applications you can use for this laser?
We would mainly be using this for anti-aging purposes. Anti-aging is a sort of an umbrella term that covers a lot of different treatments. So we might be using this to reduce top lip lines. They're quite a common area of concern for women. But also little lesions like seborrheic keratoses, you can remove these. Of course, also under the anti-aging banner is removal of thread veins, removal of sunspots, age spots, all sorts of things really.
Well, basically I had problems with my thread veins. I felt very conscious of them to the fact, well, I'm really trying to cover them up. So it took about 20 minutes. You know, Joe puts the cold blower on so it's not actually uncomfortable. Maybe a little bit, you know, red, you know, afterwards, but you can use a mineral makeup to cover it. Well, I know it sounds a bit of a cliche, but it did change my life with my confidence. I sort of had the treatment and they'd gone, and it just made me feel so much better.
So Joe, I'm quite keen to find out a little bit more about thread veins and obviously the leg veins. Now, can you tell me a little bit about sort of what causes those?
There are various different systems you can use on faces, depending on whether you're tracking into little individual vessels that you can see, and there are beautiful little diode lasers that you can literally just track along the vessel. It's like spot welding for thread veins. You can watch the vein disappear as you seal it. But if people suffer from flushing, where they will have extreme redness that will be triggered by certain things such as foods that they eat or change of temperature, we can often blanket treat or carpet bomb, as I say, the whole area. Oh, wow. And that will take back all of the sort of superficial veins. So even if they feel themselves flushing, they won't become so stressed and the flushing will not be as obvious as it was before treatment.
So what are the different types of veins you can get on your face?
Nose is one of the commonest areas. Lots of people, even quite young people, if they've got allergies and they're below their nose a lot, sneeze a lot, they can develop thread veins in this sort of area. They can also get the little sort of bicycle wheel type lesions that are called spider nevi, look like little red spiders, or even sort of purpley black lesions on the lip called venous lakes, and they work very well being sealed by lasers as well.
I've always associated veins with my grandfather. I've seen them everywhere.
Yes. Well, that is why people don't like facial veins, because they do feel they're very ageing and they do make people look a lot older. But these days you don't need to have veins on your face. It's a very simple, easy treatment to do. It's not particularly painful and it's very, very effective.
So in terms of the veins that you get in your legs,
it's a very good treatment to do. I tend to inject leg veins in preference to laser. There are lots of lasers that you can use on leg veins, but injections are still considered to be the gold standard really, because you can flush quite a number of vessels with one single injection. And what you're doing is just flushing the blood out, sort of damaging the vessel with the drug that you're injecting into it, and they just shut down, get reabsorbed. It's like recycling for thread veins.
The treatment I had was injections for the thread veins in my legs. It was almost painless, which was nice, and I was thrilled with the results.
So we're here in Essex today, and as you know, Essex is all about the glamour, but it's not just for the adults, because Michelle here has opened Trendy Monkeys, this wonderful salon in Brentwood, which is just for the kids.
So we've got the Ferrari, the Porsche Cayenne, the whole place is done out of jungle theme, so the parents can have a coffee or a tea at the tiki bar, and the kids come in here and it's all about them.
So I can remember when my kids were little. My kids are in their 20s now, and it was always, they were always very scared of going to the hairdressers, and the whole atmosphere, you know, the scissors and the horrible chair, and it was all a bit intimidating. So you're just trying to make it fun.
Yeah, absolutely. I think we really need to. I mean, the children, we've got so many children, and they all are expected to go into these really like scary salons, and every time you go in there, the parents say, don't touch that, don't do that, don't sit down, be quiet.
So the parents are anxious as well, actually.
Absolutely.
Yeah.
I mean, everyone always says if you take a child into a adult salon, you don't want them breaking things.
Yeah.
Especially not if you have to pay for it yourself. So what we've done here is we've tried to make it completely for children. We've got lollies, we've got toys, we have our TV, which so when they were having their hair cut, they can watch television. We just really tried to make it so the kids feel comfortable and happy and enjoy the whole experience. I've got two daughters, one's 3 and one's 5, and in 1 year they got invited to 3 different princess parties. So as a businesswoman, I sort of looked at the situation. I'm opening up a kids' hairdressers. I would have had to be mad not to open up the princess parlour as well, but this is where all the controversy has come from.
This has got you loads of bad publicity.
Oh, huge amounts of
yeah,
bad
for one small room.
One
yeah.
little pink room.
Oh, right. Should we go and have a look at it then? Right, come on. You lead the way. So this is just for the girls, and here, tell me what you do.
When I first thought about opening up the salon, this is what I thought it would be a good thing. It come back and sort of bit me in the bum. People actually think that I have my daughters dressed up like little dolls 24/7, and you could get further from the truth. They are mucky little girls.
Yeah.
Really mucky. I have it all to do to keep them clean. But they love coming in and having their princess little treatments done. A mini mani, a mini pedi, a fruit smoothie facial where we blend the bananas and strawberries in front of them, and then we put the cucumbers on their eyes. It does absolutely nothing for their skin, but who wants anything done to a child's skin? It's gorgeous anyway. We do a little bit of makeup and we have their updos.
Well, Michelle, it's been absolutely brilliant meeting you.
And you too. Oh, no.
What?
You've got lovely nails, but they are looking pretty dull. I think we need to.
I need blinging up.
You need some princess blingage. You definitely need some princess blingage.
Okay, yeah, go on then, lead it on.
I'm here with Dr. Ash Dutter at the Aesthetic Beauty Centre in Newcastle, and I'm really interested to find out what the men and women up here do in terms of beauty. So can you enlighten us there, Ash?
In Newcastle, the men and the ladies present with various types of fat collection which they would like to be reduced. In men, it's mostly the gynecomastia and also the sides, and in ladies, it is usually the neck, the lower abdomen, and the saddlebags. There are other areas which you do, but quite often the larger fat collections are better suited to be done with the Vaser or the radiofrequency assisted liposuction, but the smaller ones or the smaller pockets of fat are much better dealt with by the smart lipo type procedures.
I've just heard, Ash, just through the grapevine, that Newcastle is well known for the young ladies' short skirts, but it's a university town, right?
It is a university town. It's one of the oldest towns in the northeast, and I think Newcastle has got a traditional side where people are much more reluctant to come out and spend their money. The general population has got a much more cosmopolitan view on cosmetic surgery. When I started in the year 2000, the number of male patients that came through the door were less than 5%. Over the last 10-12 years, people are much more aware. Men are coming forward, and actually in my Newcastle clinic, our male presentation is anything between 25 to 28%.
Through our forum on MyFaceMyBody, we get a lot of questions regarding your concerns about health and safety. Now you're probably wondering why I'm wearing scrubs. Well, Ash here is going to obviously take us through some of the protocols and preparation that their clinic goes through if you're interested in having minimally invasive procedures. Now again, yes, I'm putting my body on the line. So Ash, why don't you show the way, and I'll see you on the other end.
I'll see you soon, Stevie. While Stevie is getting ready in the theatre, I'll take you through a few of the things that the doctors and nurses would do before they get ready. This is the clinical room, so all the instruments are sterile. And as you can see, this is labelled. We know exactly what is the last date that we can use this instrument. These are all single-use instruments. So once this instrument has been used, they are all disposed of. In the other area, we have got all the medication, all the suture materials, and all the sterile instruments. They're all single-use, and of course, they're all disposed of. Hi, Stevie. I see you've made it so very comfortable.
Oh, I do try. So what other protocols do you go through before someone actually has the procedure?
Once the instruments have been used, then they are put into the dirty urinary, which is a separate entrance into the dirty urinary room, and then they're disposed of, and all the clean instruments go into the clean room through another entrance.
Great. So in terms of safety, when someone's looking for a minimally invasive procedure, it is obviously more involved than a normal non-surgical procedure like dermal fillers or Botox. So for that, you would need to come to a clinic that has this type of setup.
The dermal fillers, the Botox, they're injectables. They need to be done in a clean room where you can wash your hands and you can clean the patient. But in a procedure where you're going into the patient's body, you need a theatre facility where we have got air change. All the air in this room is changed every 12 seconds. So all those extra things need to be going in.
So thanks very much, Ash, for all that information, but I'm going to have to shoot off now and catch my bus.
Wait, you haven't had your treatment yet.
So what do wooden barrels have in common with the oldest women in Scotland? You guessed it, whiskey. I'm here at the Glenfiddich Distillery in the north of Scotland with Louise, who's going to tell us a little bit more.
Well, the founder of Glenfiddich, their granddaughter is actually still alive. She's called Janet, and she's 110 years old this year, which makes her one of the oldest women. And it is said that it's due to the marvellous powers of whiskey, and specifically Glenfiddich whiskey, that is kept her alive until today. But whiskey itself, the name whiskey, comes from a Gaelic word. It actually means water of life. So that's got a little something to do with it as well.
Well, I'm sure most of our viewers would agree, none of us like to age. However, whiskey seems to get better with age.
Yeah, that's true. For whiskey to be called whiskey, it has to stay in the cask for at least 3 years. But obviously, the longer the whiskey is in the cask, the more flavour it's going to be. The oldest whiskey that we sell is a 50-year-old, but there has been older. I think it's around a 63-year-old whiskey that we sold.
Wow, okay. And that can't be cheap?
No, definitely not. They go for around £10,000 when they're at that point.
Now, I heard that whiskey is also good for some sort of body benefit. I've heard of this thing called a hot toddy. Is that right?
Well, it's actually called a hot toddy.
Oh, hot toddy, sorry.
And when people are just feeling a little under the weather with the cold or the sniffles, they'll add a little bit of whiskey into their hot drink and it will make them feel a little bit better.
Wow.
Yeah.
Well, there you go. There's some great facts about whiskey. Now, if you want to find out any more information on any of the topics on this series, go to MyFaceMyBody.com and don't forget to follow us on Twitter and Facebook. I think I'm going to enjoy another glass of whiskey, and I'll see you next time.
This programme, produced and funded by MyFaceMyBody, was also partly funded by Cellulase, iGuide, Zoom and resell.